Thanks for joining me, Dr. Nikpour. So can you just tell our audience a little bit about yourself, who you are, what you do, how long you've been doing it?
So my name is Dr. Nikpour. I've been a chiropractor for 19 years, and I got into spinal decompression of this business for the past 12 years. Initially, I started doing things on my own, and then I hired another consulting group to go and help me out with the spinal decompression. It was hit or miss. Then I joined another consulting group, which I used. The results were okay. I'm not going to say great. It was hit or miss. And it was also very hard to get hold of the consultant people that I would actually do on my Facebook ads. And then this past year, again, I joined another group that they were doing advertising for Facebook, or actually trying to help with spinal decompression. And to be honest with you, that was just money down the toilet. Until I met Steve, you. And
how did you learn about me?
So I met another doctor who uses you, and he spoke very highly of you. Again, I was a little bit skeptical because I personally, from my personal experience, what I have gone through with different consultant groups. And then, of course, I signed up with you 2 months ago. Yeah, give or take 2 months ago. Mm-hmm. And the first month paid off right off the bat.
Yeah, we are exactly, I think we're about a month and 3 days into the actual ad campaign, right? We actually launched.
There you have it. Yeah, and it's already paid for itself, and probably for the next 2 months.
Right. So tell me a little bit about the circumstances, like in your local market. I know when I first was introduced to you, there were some things going on in your local market. There were specific details that was driving your desire, your need for marketing.
So one thing I realized, I mean, previously with the other consultant ones, they would generate leads, but they would never come in. Or if they did come in, I could right off the bat, I could tell if they were good leads or not so good leads. One thing I realized with you is once they come in, they're already ready to start the treatment. At least most of them, whoever has been here. I'm not going to say they'll all sign up. That would be a lie. But when they come in, they already. I don't know how you run the campaign, whatever you do, or however you tweak things around. When they come into the office, they're already sold. They're already ready to go. These are good quality leads that they actually come in because they need help. They've knocked on a bunch of other doors. They could not, but somehow, whatever tools you use, you get them out of their shells and they come into our office. And as I said, they're ready to sign up. That's
great. That's great to hear. So tell me a little bit about where the practice was before we got started and kind of how it's trending now.
So, as I said, I've been doing this for 19 years. I started doing disc past a little over 10 years ago. As I said, I've been using some other people for the past few years, but this past 2 months, I mean, I'm hoping that this is even going to get better as we get from here on. I'll tell you, just this week, I signed up 5 people. Just alone this week, I closed 5 cases.
That's amazing.
So that you can do the math.
That's great. That is phenomenal. And that's 5 people for surgical spinal decompression.
All of them, because that's all I do, spinal decompression.
So is there any other, I know you've worked with other marketers before. Is there, how would you describe the difference between the experience of others versus
I'll tell you that this is coming from my heart. Previously, from the previous marketing, I would have to email, I had to set up an appointment, and then maybe the next day, if I'm lucky, maybe 2-3 days later, I would get a call. With you, Steve, I pick up the phone. I don't care what time of the day it is. I'll call you, pick up immediately. Or you shoot me a text, hey, I'll call you in about 5 minutes or whatever it is. I'm on the other line. So that's another thing I like about you, because I can get a hold of you. I don't have to wait a day or 2 or 3. Even a week I waited for another person that I was dealing with, working with. So that's another advantage with you. I can call you. You can pick up the phone immediately, and no hesitation as far as answering any questions that I have. So that's another advantage.
Well, good.
Very easy to get a hold of.
Very cool. Thanks, Doc. I appreciate that.
No worries.
So this week you've signed up 5 patients for non-surgical.
Yep, just from the Facebook ads. Yes.
That's amazing. That is.
That's why, as I said, I've done Facebook before, and they make an appointment, they never come in. We'll try to get a hold of them. They don't come in. Even if they did come in, it was iffy. But what I've realized, these guys, when they come in, I mean, they're ready to go. Right. All of them? No, but most.
Sure. Well, my next question was going to say, how long did it take to catch fire? But since we're in the fifth week of advertising,
right,
and you signed 5th clients, I'd say it took about a month for it to really catch fire.
Right. So, I mean, right off the bat, as soon as I started up with you, I remember the first day leads started coming in.
Okay. And then how long did it take for you to sign your first case fee for spinal decompression?
I mean, as soon as the person came in, obviously, when the patient comes, obviously you get them into the office.
Right.
Whatever you're doing, you get them in. Once they come into the office, now you got to use your own tools to show the patient, hey, there's another alternative besides surgery for you. And that's when, as a doctor, you got to show them what tools you have.
Right.
And as I said, when the patients from your side comes in, they're already sold. They leads that come from you. They have a higher chance to stay and sign up as a spinal decompression patients.
So would you say it was that first week, that second week, that third week?
I would say second, third week. Third week, yeah. Third week, which I know, I'm sure this is not always the case. Sometimes it can take a month, 2, 3, 4, 6 months sometimes.
Sure.
Because you just have to organically get them going. And you know what? I give you one example. One of the patient, first she ignored the Facebook ad, and then it popped up to her Facebook. Finally, what do I have to lose? And she called. She came and signed up.
Very good.
So that's another way of, they might not come up, they might not pick up, they might not sign up with you right off the bat, but the more they see it, then they realize, hey, maybe this is a sign that I need to go and see this guy. And that's what happens.
How we follow them around a little bit.
Right.
So your staff is a big part of this, right?
Oh, absolutely.
Whenever you do any type of lead generation, no matter which medium you use, even if it's Groupon, right? Your staff is involved in scheduling, and they come in and doing the onboarding paperwork and everything else. So, and you've done marketing before
right.
you and I.
Correct.
Started working together. So tell me a little bit about how your staff has received this. That's a big part of the practice. Is the staff is either thankful or the staff is like, this is
course. They already told me we might need another person because we were already busy, but the Facebook has taken us to the next level.
Okay.
It really has. I'm talking about for the past week, almost 2 weeks. For the past 2 weeks, I should say, we just went from here to here. And it's truthfully, if this rate continues, we might need to hire somebody else and maybe even get another table. They don't have any issues with it. They're happy because if the more lead you generate, the more money I'll make. They make money. So because they make bonuses.
So talk to me about what happens when a lead comes in. So okay, you get a text message, an email, your lead comes in. What happens in your office? What happens next?
So what I usually do, we try to call them immediately, and sometimes we get through once we call them, they pick up, we talk to them, and we schedule them to come in. Most of the time, sometimes they could be at work, so we leave a message, and then we also get a text. By the way, not only get a text, we get an email. So first we get a text and email, and then we call the patient immediately. So if they don't pick up, we leave a message, and then we shoot them a text and we shoot them an email. Typically, they call us back. If they don't call us back, we call them back. We don't want to harass them or anything like that, but we call them the next day.
Mm-hmm.
We try 3 times, sometimes even 4 times to get a hold of them. If they don't call us back, obviously, we look at them like, okay, you know what? You were interested, but I'm sure you're going to see my ad pop up again. Eventually, going to call
me. Right. Okay. Very good. And then I'm going to ask more about the front desk because many times when doctors do internet marketing, their front desk staff is either really happy about it or really upset about it. Because if they're just chasing people around, giving them a lot of work, and they get very frustrated and mad almost mad at their boss. They get mad at the doctor, right? So has this been any different? Has this been a different contrast?
No. Or actually, one person is handling that handles all the leads.
Okay.
No, because as soon as the email or text comes, she does get the email. I get the text, and I immediately forward. Now, here's a funny part. I realized, I guess these are some of the people that can't sleep. They're in a lot of pain. A lot of texts or emails I get is like 2 o'clock in the morning, 1 o'clock in the morning. I'm already asleep. So we usually call them the next day. But the ones that usually come during the day, we call them immediately.
Sure.
But the ones that come at night, obviously I'm asleep. As I said, like last night, we had two leads come in. One was like 2 o'clock in the morning.
Sure.
So I saw this morning, we called them up. I'm not sure if she got a hold of them or not, I'll be honest. Okay. But obviously, if they did call, they're in pain, they want to come in.
That's right.
But no, as far as my staff goes, so far, they're happy.
Very cool. And doctor, it's been a real pleasure working with you. You're very easy to work with. It's been a privilege and an honor, and I really appreciate that. Is there, first of all, why should someone, or should I say, should someone work with me? And if so, why would you think someone should work with me?
I've been burned before. I did the burning for you guys. So I did the experience. And if I didn't see results from you, I would not be having this interview with you right now.
I appreciate that. Is there anything else you'd like to offer our audience or those watching this video? Anything else you'd like to offer in closing?
Sign up with Steve, man. Sign up. He will deliver. Seriously, here you will do. You'll have for me. And as I said, if you hadn't, I will not be having this interview with you. So go ahead, sign up with Steve. He'll help you practice.
I appreciate that, Doc. Thanks so much.
My pleasure. Have a great day.